guys, my lips are a bit dry, but that's whatever. Here's Aussie Marlene trying to, you know, get us out of this parking thing that's happening here. Anyway, guys, so today was our second day or third day? Third day. I think our third day of PEDS, but I mean, it's more like second day. But third day of PEDS. And yeah, man, it was a good day. It started out a bit, you know, like, because we came here in the morning trying to do observe like procedures done on these little kitties and stuff, and we just weren't getting any. It started off a bit sad, shame, in the morning because there was a neonatal recess. So this kid, shame, not even kid, like preterm baby, was like proper ish. It was so sad. And then we got there, and then we just saw like a lot of doctors around, like one patient like speaking like very loud, like, okay, give me this guy. We're like, is that a recess happening? And then I asked one of the nurses, like, sorry sister, is that a recess in there? And then she was like, yes, it's a recess. Then Marlene and I went in, we're like, okay, let's go observe like how a recess is done. Now we get in, we see they're doing this, give surfactant, give this. Like, it's like, oh, okay, we're giving surfactant, oh, giving this, oh, interesting. You know,
I didn't even know that surfactant is white.
Yeah, like today I learned that surfactant is white, and you give it via a catheter. Like you put a catheter straight into the trachea and then you give it. I was like, whoa, okay, interesting. Anyway, so we watched, and then I don't know what happened afterwards, and eventually like there was too many of us and we had to like leave and stuff. But then sadly that baby didn't make it. Like the baby was not thriving like at all, like was not doing well. And then we had to like leave and go do other things. So we went like everywhere, to clinic and all these different places to try and find like procedures to do and different things. And the clinic, like today was just very weird. Like in the morning, clinic empty, like there's no patients, and it's like on a clinic day, like there are no patients. So we're a bit sad, like, oh, you know, there's nothing to see, nothing to do. And then, oh, this lighting is changing now. Anyway, and then afterwards we're like, oh, okay, so I had a mini CX, and that's like basically a mini clinical examination. I got there, I was doing that. Marlene was with another group, like they were like with another doctor, so I had to do my examination on the child and then discuss with the doctor afterwards. I did that, and went very well. I'm happy about it. And then afterwards we're like, you know what, let's just go check in neonatal like section again. We went and we found this other doctor. He's so nice, like, oh, I feel like he's adopted us now, but like that's just me. And then we did like other stuff with him, and then they were trying to put up an IV on this other little cute baby. Shame, like, oh, they were struggling. Other doctors came. Guys, first time today ever, Marlene, first time ever watching. Yeah, we saw how like they put up a drip on a baby. Like, okay, like they're different points. It's so weird because there are different areas where they try to put up drips on a baby as compared to an adult. Yeah. And the other thing is that when they're failing to get a drip like on a baby, there's something they put it on the head. Like they try, like it was so like, whoa, they shave the baby's head, and then because the baby's crying and stuff, so in the veins or the arteries, they pop, not pop, but like, I mean, like they show properly, you know. And then they were like, yo, no, we have to should we shave? They're like, yeah, shave. And then like they're shaving the baby. We're like, why are they shaving the baby, you know?
Tell them that we're also in there.
We were also in there giving stuff. Oh yes. We're there. They're like, okay, give us this. Marlene's like, okay, this, okay, put some water there. I'm like, okay, I mean, we're in this, you know, I mean, like, we're part of this procedure. Anyway, now they're shaving the baby's head. They're trying to find, guys, it was so interesting because like there were 3 doctors all on this, like, baby. I'm sorry, guys, this baby is literally this tiny, like literally like my hand. Okay, maybe not my hand, but like maybe 2 hands. Yeah, like literally up to there. The baby is tiny. 3 doctors around their baby trying to put up an IV on different points. Then getting the blood, like flashback. Oh, it was just, yeah. But guys, eventually they managed, and it was so nice. Like, oh, we're like, oh, sure, they managed everything. Then like, oh, it was nice. But anyway, guys, that was our day. Now we're just heading back, and yeah, we have a tat. But like, yeah. Anyway, Marlene, bye.
It was a great day. Bye.
So guys, I forgot to mention something. Marlene just reminded me. Today we saw a baby with Trisomy 18. Oh, that was like my first time ever. Was it your first time, Marlene?
It was my first time.
First time.
Actually, I didn't know what it was. I'm like, oh, I can see this.
There's this, but they're like, what is that?
Yeah.
Oh. And guys, we forgot something. So, okay, it didn't start off bad. It started off actually very nice. Because we went to the neonatal ward, and then we saw this other intern. So we're just asking like, oh, okay, when do you guys do procedures and stuff, whatever. Then I was like, okay, let me just take this chance. I'm like, okay, I asked him like, can you please just show us how to examine like a neonate? He's like, oh, okay, let me just do it now. Like, he showed us everything, like taught us what to look out for and stuff, you know. And then when we were doing we was taking blood on this other baby, And then that baby had trisomy 18. So the child had like dysmorphic features and stuff. And then he was like, okay, so guys, this is a very nice baby. Since we've gone through examinations and stuff, what do you see? And then we're like, and he told us what the baby has. And then we looked up, like we googled on the internet the clinical features, and this child literally had all of them. It was so interesting to see. I mean, obviously it's sad and stuff, but like, yeah, it was interesting to see. Good morning, everyone. Hi guys. Hi. Oh wow, okay, there's Marlene. Hi Marlene. Hi guys, welcome back to my YouTube channel. For those of you guys who don't know me, my name is Lasara Matapa, and I am currently a 5th year medical student at Wits. And yeah, welcome. So today is a Monday and we're on our way to hospital. We're currently doing peds, and this is our third week, but it's our 4th day at hospital. I know, so with peds we don't go to hospital every single day, we go like every other day. And we started it when it was the public holiday and stuff, and then we were also having online like stuff like seminars. So we haven't really gone to hospital. This is our 4th day. But yeah, so yeah, come along with us today and you will see what we get up to. Hopefully I don't forget to vlog, because sometimes things get hectic and you forget to vlog, like there's no time for your phone. But anyway guys, bye. Hey guys, so it is, what time is it? Around 11 I think?
It's 20 past 11.
20 past 11? Okay, and we had such a nice day, such a early morning, nice morning. We went to clinic and we were like seeing babies, weighing them. Oh, they were so cute. Oh my goodness, literally dying. Like, not the babies, I'm saying me. I was dying when I saw those babies and how cute they are. And like, it was so cute, and the nurses were so nice. Like literally they were teaching us stuff. It was just amazing. And then afterwards we went to the wards because there was people presenting patients and stuff. So we went there for like a learning experience. And yeah, it was really nice. So now we're just coming to the car to get a couple of things, and we're going back to the ward. And then yeah, hey guys. So our day is done. It was a very like weird way to be done. Like we just decided, oh yeah, no, we're done. Like it wasn't even like a thing where we're like, yeah, at this time. But anyway, we had a very interesting day. So as I mentioned, we had clinic, and then after clinic we had presentations and stuff. So now we're gonna go just study and stuff, because what we're also realizing is that in as much as we're able to do like the clinical examinations and stuff, but it's just as important to be able to correlate your findings and to be able to know exactly, like know the theory behind the stuff that you're able to like pick up. Because it's one thing being able to pick up something, but if we can't explain or come up with differentials, then it's not that beneficial for us. So now we're gonna go study. We've done a lot for today. We're very happy with what we're able to do, and yeah, we're gonna go study. We don't have hospital tomorrow, so there's also that. We're very happy about that. And yeah, Marlene, anything from you? Marlene, speak.
Oh, okay, fine. I don't know what to say. Like, don't put me on the spot and be like, speak. It's like,
you guys can see that
I'm hungry. I'm hungry. That's what I'm gonna say.
But you can see that I'm the talkative one in this. And yeah, but also how cute are my scrubs? How cute. These scrubs are from Mucal Clothing. If you guys have not watched the video on my scrubs haul from Mucal Clothing, check it out guys. They are so gorgeous. I told you guys that I'm gonna wear them when I'm feeling good and stuff, and I am wearing them because I'm feeling good. Anyway, bye. So just finished with the tat. You guys can't see me. You really can't. That's my Bonnie and Marlene, but you can't even see them. But like, it's whatever. Anyway, had a bit of a study session, and now we are going back
To study some more.
to study some more
Yeah,
because
like,
course is real as always.
Yes, is just kicking my ass. And it's not that I don't like babies. I love them. It's just the hospital is not conducive to my learning at all. I just feel as though I'm suffocating. I'm drowning.
I'm barely coping.
I just feel like I'm barely coping, even though I should be coping. Because not because I don't know my content. It's just because I don't like the place I am.
Yeah.
Like, environment sets the tone for your learning.
No, it really does. Like a place of work.
No, my place of work is not like
Is not nice at all. But yeah, guys. Anyway, you'll see me just now in the car. Woo. Let's see. So now we are just heading home to study some more. My Bonnie, can we see your face? Maybe come through. There's me, Bonnie. There's
my
Bonnie.
place of work. Shocking.
It's not the one, right? You don't agree.
No.
Anyway, guys.
I know about it as a specialty.
Now you're like.
But because of my place of work, I was like,
I feel like, guys, place of work and the doctors that you work with. Like for me, for example, with urology, I had really nice doctors and I loved it. And then people had horrible doctors in urology at another hospital and they hated it, you know? But like,
I
it's
had
because
nice doctors, but it just wasn't for me. Like urology, I had nice doctors, no jokes. I can't even like
Yeah.
fight. They're not nice there. They were just like
okay.
Like the consultants were just like, yo, but the doctors were decent, like nice people that were teaching. So I was like cool with it, but it's just not for me. Like as a
Not for
specialty,
you.
I was just like, sorry, it's okay.
Yeah, so guys, if you're a doctor or whatever, be nice to people, you know, be nice to students. Because
If
those
you're
things
an
really
intern,
hurt you. If
actually,
you're an intern,
Understand
be
that you were once
nice.
in my
You're once-
position, just
Literally.
a year. Less than
Literally.
6 months ago, you were in my position.
So be nice to students because that influences a lot. Like guys, not just mental health vibes, but like whether or not we
you're
enjoy our studying. Do you feel like studying anymore? You know what I mean? So be that intern, be that doctor, and you know we all want to get there. You know, so encourage us and help us. Anyway, guys, bye, bye, Molly,
Bye.
We point you from the back. Hi guys, so we are back at this plantation sooner than we thought. Well, this is Moiponi's plantation, but anyways, yeah, so our tutor literally just like hit us up on the spot and was like, I have a patient for you guys, and now we're just
Now.
like,
I
now
was like, come quick.
listen,
now.
literally, like now you must come see a patient, I have a patient. So we're just like, okay, that time we haven't even showered.
We're chilling in bed.
Bruh, Marlene is running around. So like, yeah. But anyway, it's gonna be a good learning day. Anyway, bye, me Bonnie.
Bye.
Bye, Molly.
wedding.
We sucked. We literally sucked. We Bonnie.
No, like honestly, you need such patients every day.
Every
to
single
remember
day.
what to do. It's
Yes.
muscle memory, honestly.
Because literally we were just there and we're like, you know what? You forget how to examine. No, guys, you forget how to examine. You're like, where do I start? Okay, I'm looking for timing. Okay, yo, damn.
Okay, our meeting just started.
Really?
Yes.
Just join. I'm with you, I guess.
You must write
I'm at
it.
1%.
Yeah? You must write it. Like type in the chat with
Oh.
me, like I'm with Marlene or Marlene is with Lesotho. So that
Yes.
when at the end of the meeting, I saw there's like a register that comes out
Yeah.
that they download.
Oh, damn.
Yeah.
Yeah. Guys, yeah, no. When Palisa was like, just because the patient is delirious doesn't mean that you must be delirious in examining. I was like, good.
What are you doing?
One person is touching the hands. What are you doing? Actually,
Like,
actually, what are you doing?
We freaked out when she said,
Yes, so
5 minutes
I
left.
was just like, what?
No, but she's right. It's going to be a timed exam that you're going to write.
Bruh.
You won't have 7 million hours.
Yo, that was.
Even those histories, guys. The questions are all
Guys, it was
So this guy just wanted to tell us everything.
like it was.
It
It was. Yeah, all I'm saying is we have an exam in 3 weeks' time, clinical exam, and we literally need to prepare. Because I feel like the thing is, we felt that we'd fall short on like our theory. They were just like, no, we need to focus on theory. Even today, when she said we must come, we were like, yo, what if we don't know enough theory? But then now the thing is, we don't know enough. Not that we don't know, but we're not great with our examination. Oh, sorry for the noise. So, the thing about internal medicine is that if you're not good with the examination, you won't pick up the signs. You won't pick up the signs that you should. And if you don't pick up the signs that you should, then you won't know what theory you need to like correlate, what theory you need to. It just, yeah. What I'm saying is practice, practice, practice. Cause child, nuh-uh. But anyway, hi guys. Ooh, sorry about that. Hello everyone. So today is a Friday and I had hospital today. Today was a very interesting day. I had a mini CX, and so it's basically a mini like clinical examination, and I was doing it on a patient. Funny enough, you know guys, funny enough, on Wednesday when I was at hospital, there was a patient that had recently come in and the child has Guillain-Barre syndrome. So now I was like, oh, this is such an interesting case because I've seen a patient with that condition but like in internal medicine. So this patient was like much older. So I was like, okay, I wonder how it is in younger patients. So then I was like, okay, let me just go examine this baby and actually see what size they have, and then maybe I can use this baby for my case report because you have to write like a case report. Fine, I did that. I did all the examinations and everything. And then, okay, yeah, so I was saying, sorry guys. So I was like, no, I want to examine this baby and. So then I examined the baby, I did everything. And then today, the doctor came, I had a mini clinical examination. So I did that just for my own learning and stuff. And the doctor comes and then he gives me that patient, like he didn't know about it. It was just like, oh no, there's a patient, very interesting presentation. I want you to examine this baby. And I was like, okay. That time I'd already done the history. I had already done everything. I was just like, oh, okay, that's fine. And then I literally just verified everything, just double checked some of my signs and stuff. And then I presented the patient. And then it was like such a lengthy discussion and stuff. But like I knew like some of the answers and stuff because I've had like a patient with Guillain-Barre, which is very interesting. So I knew some of the answers to the stuff, what to say, what are the things that I'm looking out for. Like, you know what I mean? Like some of those things, and my team, like my group members are also like putting in a bit of input here and there and stuff. So that was really, really nice. So that's all I basically did today. But Marlene, on the other hand, had a very interesting day. So we're gonna have a word from Marlene. Got my phone.
Okay, so today I'm actually forced to talk.
Yes. Oh, by the way, as you can see,
we are matching.
Literally not planned
It
at
wasn't
all.
planned.
We just so happened when I walked in the car, I was like, what? Anyway, yeah.
So we have this research where we have to interview 10 patients, interview them about the chronic illnesses that their children have. So it was a very emotional day for me because I actually spoke to the mothers and how these illnesses are affecting them, and one of the children has SLE, and SLE for me is like such a touchy topic because I have someone in my life who has SLE. So now this child is like 12 years old and she started experiencing all these symptoms when she was like 9. Yeah, since 2016. Am I calculating right?
I don't know. Since she was 9.
Yeah. So she started having liver cirrhosis, and then it progressed, and then now she has kidney problems and also neurological problems as well.
Yeah.
She's just so sick, and the mother is always going in and out of hospital. It's just a lot on the family, and for me it was just too draining and so sad. I almost cried, but I can't cry.
Let's keep it together, keep it professional.
Like, I had to keep it professional until I was in the car and be like, okay, you know what, today I'm not okay because of what happened. But all in all,
She had a very nice day. She had some patients, like literally patients were so, not the patients actually, the mothers were
yeah,
literally just like, they were so touched by like what she was doing. I mean, obviously for us it was like a question that we had to do, but she was inquiring a lot more about the parents themselves.
Yeah.
How are you guys doing? And I think for them it was such a touching thing because most of the time, like the
We
doctors,
always
whatever,
ask
or
about
even
the
us, we
kids,
always
yeah.
ask about the kids, but never the parents as to how are you doing? How was your life before this? You know, what do
Yeah.
you miss? You know, and for them it was so touching. One of the ladies was even telling Marlene how happy she is that
I
she
actually asked where is she from?
lives. Like,
How
where
is
you from?
she?
How are you doing? And she literally was so emotional.
Yeah,
because,
she
like,
actually cried.
she cried. Like, people
cried.
don't ask that.
She's like,
So for us, it was such a it was a learning like sort of experience outside of like textbook medicine, to say at the end of the day, in as much as these are patients that we're seeing with great clinical signs and like very good for our learning, but remember that these are people at the end of the day. These people have feelings. This was somebody before the child got sick. They had their own life, they had their own things that they look forward to. Some lady was talking about like her dog, she misses her dog, things like that.
Apparently this dog takes care of the child. So every time the child tries to stand, the dog comes and just makes sure that she doesn't fall. Like all those things. Like she told me a lot. She told me that she recently just got a new stand. Like so before this, she didn't have like a formal
housing,
settlement. So like now she got her new house. She's like, my address is stand number 1 like something. Like it was so nice, and I was there hyping her. She was really
she didn't want
happy.
Marlene to even leave.
She didn't want to leave.
Somebody's just talking, you know, like when people just talking to you as a human being, not as the mother of a child who has, you know, it's just you as a person. So yeah, this is definitely a learning curve for all of us, for us this definitely was, and for other people, if you are watching, if you're going into this field, or if you're already in, just to remind you that at the end of the day, the people that we see every single day are people. They are people. They have lived experiences, and they too matter. Anyway, guys, we had a very interesting week. And so we'll see what next week has in store for us. This is the end of week 3.
Oh yes, week 3.
We have 3 more weeks to go, and so bye.